My name is Lydia Sanchez and I'll be performing my Foley catheter insertion and removing checkoff video. So first you're going to want to check the physician's orders to make sure that it's the right patient that you're doing the procedure on. After you're done with that, you will gather your equipment, which is the sterile gloves if they don't fit you, and the catheter sterile kit that you'll need. So after you have gotten your equipment, you will go into the room. You would either close the door or provide privacy, but before you do that, you'll perform hand hygiene. And then you'll have your equipment with you. So you'll set it either on the table that's next to them at the beginning, and then you'll provide privacy, and then you'll go into the room and you'll ask the patient for 2 identifiers, which is their date of birth and their full name. Once they tell you that, you will go on and explain to them what the procedure is, why they're getting a Foley inserted into them. So you'll tell them that it could be because their bladder is full and they're not urinating like they're supposed to, and their bladder is already extended and they have pain, so they have to have some type of relief, and the doctor ordered them to have this done to them so that they can see the output that they have. Or you can tell them if they are having another procedure that the Foley is going to be inserted in them for a couple hours, or how long the procedure is going to take, and then afterwards it will be removed. After you have explained that to them and they know that that is going to be happening, you will raise the bed up to your waist level. I cannot do that because I don't have a hospital bed, but in real life you would raise the bed up to your waist, and then afterwards you will explain to them that you will be performing prenatal care, which is just washing their private area. After for that, you would get some gloves, put them on, wash, make sure it's completely dried, completely clean. If it's an accountant patient, make sure everything is clean. After that, you would dispose of your gloves, try to have a trash can near you, and then you can grab your stuff, put it on the bed, and then you'll have a sheet over them to provide a little bit more comfort so they won't think that they're too exposed out there. And you'll have it like around their waist, around their hip area, or you could see their prenatal area, so you'll be working with that. So you don't want to cover that, you want to have that exposed, but you don't want them to feel too exposed. So you'll tell them that you're about to start the procedure, and you'll put your gloves to the side right here. Take out your package. Set it in front of you. Throw this away. Throw that away. And you're gonna pull away from me first, so it's gonna be the furthest away from me, because you don't want to reach over again and then your break's still filled. So you'll pull that way, and you'll pull towards you. And you pull out that way and out this way. You have an inch border of non-sterile fill, so you'll put that there. And then you'll get your gloves and you'll open them away from you first and then close to you. Open it all the way. Give it a little pull. And then I'm right hand dominant, so I'm going to do my left hand first. So you'll just grab it, pinch, and pull through. Okay. And then with your other hand, you'll use these 2 fingers and you'll grab and you'll pull up straight and you'll put it on. Okay. Good. And you'll grab them together to make sure that you don't break sterile fill, and it'll go below your waist. So once that's done, then you can touch anything that's in the box because you have sterile gloves. So you're not going to use the gloves, so you'll put that underneath, or you'll just throw it away, but make sure that you don't go below your waist when you're throwing away, so just put it underneath your box. And then you'll have your sterile fill that you're going to be using, so you'll open it up. Shiny side to the bottom, the dull side to the top. You'll wrap it like that. Put it near, as close as you can to them. You don't want to touch them, you just want to touch the sterile field. And this one, you can put it over their private area so you won't have to see nothing else but the part that you're working with. It's mostly used for men, but a lot of people do not use it. So if you're not going to use it, you'll put it underneath your box. And then you'll take out this little carton and you'll set it right here. And you'll start to set up. So you'll take out all your little swabs that you're going to use and put them on top. You'll open up your lube that you're going to use for the Foley and you'll throw it on the thing right there so you can use it later. And after that, you're going to open this up right here. Throw that away. You'll put it back in the box. And at this time you will insert your syringe that you're going to be using. Throw this away. Put it on the port. Okay. So then you're going to tell the patient that you're going to clean them. So you'll use one hand to open up the lips, because it's the female patient. And you will always clean away from your first and then in and then down the middle. So you'll clean on the inside. And you'll throw it away. And then you'll clean in the inside. And you'll throw away. You'll clean down the middle. And you'll throw it away. And after that, you're going to tell the patient, can you bear down? And you'll lube up your catheter. And you'll slowly move it towards you. And you're going to put it in until you see urine. You want to make sure that it's in place. Into your syringe. You're going to blow up the bubble that's inside. You're going to fill up the balloon. And after that, you're going to remove the syringe that you're using. Throw that away. You're going to pull until you feel resistance. And after that is done, you can let go. Remove your gloves. Get some new gloves. And then bring this over their leg underneath the bed. Put it on the bed frame, not the side rail. And that way the urine can go down into the bag. And you'll be recording that as much as they go. And then after that is done and you have the bag at the bottom, you would get all your supplies and you would just throw them away. You'll discard your gloves. Tell the patient that you're going to be checking on them. Make sure all the rails are up. You give them the call light so they can call you if something goes wrong. Then you will, since you already discarded your gloves while you were doing that, you will walk out the door, perform hand hygiene, and that'll be it for the insertion part. Now, the removal of the Foley, you would make sure that they have physician's orders to be removed and make sure that it's the right patient. You would ask them for 2 identifiers, which is their date of birth and their full name. Once they have told you that, you are going to explain to them that the doctor has ordered for the Foley to be removed. So for this, you're not going to use a sterile technique. You will use hand hygiene before you do it. You would put on a clean set of gloves, and then you would just perform a clean technique. Not sterile or anything. You would put the Foley on here. You would remove the urine from the Foley first, and then you would connect your new syringe to the port, and you would deflate the balloon inside. And then slowly pull it out. Make sure you have a towel because urine can come out. Slowly pull it out. And you would remove this. And after that, you would possibly want to clean the patient because there could be urine there too. Make sure he is clean. You throw away all your supplies that you used to remove the Foley as well. And after that, you put up all the spiros, you give them the call light, you tell them that you will be checking back around 4 hours to see if they have urinated again. And that is about it. That is how you perform the insertion and removal of a Foley catheter.